Hello and welcome, everyone. This is Eric Glazer, and you are entering into Bright Spots in Healthcare's live recording produced by Shared Purpose Connect. Each week, or each episode, I should say, we bring leaders together to not only inform our audience, but also unearth bright spots, successes at health plans, hospitals, and various other healthcare organizations around the country. And our goal is to identify as many bright spots as possible so that you, the listener, can determine if the ideas shared on our show are able to be applied at your organization, because we believe that this approach of finding a bright spot and cloning it is the most effective strategy to improve healthcare in our lifetime. I often go on about what a privilege it's been over the last almost now 8 years to host this show and get so many esteemed leaders in healthcare to come on and offer all their great advice. If you are just new to the show or missed some episodes, or even want to go back a year in time where there's still some relevant, fresh content out there, I encourage you to subscribe to Bright Spots in Healthcare. It costs you nothing. Just go to your podcast app on your tablet or phone. You could use Spotify, Stitcher, Apple, Google Play, whatever you use, Amazon to consume your podcasts, and just type in Bright Spots in Healthcare and subscribe. And you'll be able to get all the episodes once they drop, usually a day or two after a live recording, right into your tablet, so you could never miss any of the great content we have for you. Today's title of our session is Why Patient Engagement Doesn't Work, Lessons Learned to Drive Consumer Empowerment. You have a Q&A module at the bottom of your Zoom screen. You're probably all experts at Zoom by now. Feel free to ask questions to our panelists. Sherry Keels and I will moderate those questions and integrate them into the conversation as deemed appropriate. Please do not use the chat to ask questions, because it's just not as easy to manage the queue. You're more likely to get your questions answered by way of the Q&A module. Today's episode is compliments of our friends at Appnovation. If you haven't heard of Appnovation, they are a global digital consultancy that combines strategy and member and user experience and design and technology to deliver a human-centered member experience via a digital platform. And I'll explain a little bit more about why I included them in the Bright Spots in Healthcare family and show later on in today's episode. But if you want to check them out and find out more about them right now, it's www.appnovation, that's appnovation.com. We're going to bypass bios as we typically do in the interest of time. We have a ton of content here, but Sherry Keels is going to provide you a link that gets you to our website, and you can click on each individual panelist and review their bios so you can get a sense of the great experience and expertise you're about to receive. So check that out. Also, in about 45 minutes, you'll get an email from me. As you regulars know, we have actually some new questions incorporated in there that ask for your feedback on what we could do moving forward to make these episodes as valuable or more valuable for you throughout Q4 and into 2022. And we'll keep on emailing you until you give us those 2 or 3 minutes of feedback. So I encourage you to save your inbox and please take that survey, those who are attending live, at about 45 minutes past the hour. All right. Let's get started, and I'm going to bring in to start us off Susan Edgemont Levitan, who is going to sort of set the stage for us and just answer the question of, from her perspective at Mass General, why doesn't patient engagement typically work in healthcare? Go ahead, Susan.
Thank you, Eric, and thank you for inviting me to be here. To be brief, my concern about many of the patient engagement apps and approaches, and the reason why they don't work, is that patients with chronic conditions and health issues that really need to be engaged in managing their care are almost never involved in the design and the development of these approaches. And most people with the chronic condition, even people who really care about taking care of themselves, staying healthy, really don't like being reminded constantly that they have a chronic condition. So it's one thing to wear a Fitbit where you're really trying to look at how you can stay healthy and do something that's fun. It's another thing to get a buzz every time you need to take your medications or you need to check your glucose. So I think that's a big reason. I also think that in the digital app universe, one of my big concerns, and it's a concern that we're trying to address in our health system at Mass General Brigham, is a lot of the digital apps don't work for the people that are most at risk and need the most support. Because many of those people are not people that are facile with technology or that even have access to technology. So I think it's incredibly important to think about what mode of engagement are you using, and is it the right method to engage the population of people that you really want to support? Because many people with serious chronic conditions really need high touch support, and especially people where English isn't their first language, they may have literacy issues and that sort of thing. So I'm going to stop there and we can keep going.
No, it's great. So I wanted, and we're going to actually close with that same question if we have time, because I do think that's sort of the framework. But as those of you know, and I produce this show with a very focused lens on not necessarily the echo chamber and healthcare, the problems we all are challenged with, but more on the solutions and examples. So I asked Susan sort of to set the stage for us, and I'm going to ask the same question at the very end, hopefully if we have time to get another perspective on why sort of engagement doesn't work, to another one of our panelists towards the end. But I want to now bring in our first example and see if we could put Steve Parrot at Appnovation on the spot here. And Stephen, can you provide us with an example of how a health plan applies or has applied consumers' perspective and their point of view into driving better digital engagement?
Yeah, absolutely. And it's eerie how similar some of the messages to Susan's, the perspective of, what a wonderful time to be in digital and looking at patient engagement. But, we have to navigate the realities that even though we, of course, want to help patients, they don't want to be reminded every single minute. So it's a very sensitive process in what your message is and making sure it's personalized. So really appreciate the way you kicked that off, Susan. So yeah, in terms of this example, we are working with a highly reputable payer, and they were losing market share amongst the Medicare Advantage population. And if there's ever a time that people actually do want to hear from you, it's that moment when they're shopping for a plan. But the issue was not about brand awareness. It was an engagement issue. And the site across the board, it was, very consistent, seamless, but they have a lot of plans to offer, and it wasn't personalized for that 65 plus audience. So the opportunity was pretty clever. They wanted to consider creating a Medicare Finder tool that personalizes the recommendation based on the individual's needs. And it sounded promising, but rather than rushing to a technology, we actually applied a lot of what Susan is saying, and we shifted the focus to understanding and empathizing with the prospective members and designing the experience with them, because otherwise, clearly, we could miss the mark. So just quickly looking at how that actually worked, we ran lean research where we were able to integrate ideas while designing and address that audience feedback in real time.
Hey, Steve, just for like 30 seconds for those of you those people that don't know what lean research means. Can you just describe it?
Thank you. Yeah. So we call it lean research because the term research can actually sound very daunting. It can sound like a 6-month process done in a vacuum. But in our case, we'll leverage tools like Figma, which is a very lightweight design tool. And literally during the design phase, we'll be able to iterate and make changes based on actual customer feedback. So I'll actually run through pretty quickly here some of the highlights of how lean research works. Does that sound okay, Eric?
Yeah, perfect.
Awesome. Okay, so it starts with recruiting, right? That's the first scary example. Oh my God, how am I going to find my population? And the fascinating thing is that Nielsen ran this brilliant study, and they showed that the point of diminishing returns is actually testing with only 5 people. That sounds crazy, but strongly encourage that read because we certainly found that to be accurate. We recruited based on the demographics of the region, obviously 65 plus, and the only sticking point that we had was the requirement of people needed to be in the mindset of looking for a plan. We ended up testing with 20 people just for that extra layer of confidence, but we certainly saw that point of diminishing returns pretty early. In terms of what we put in front of people, for that lean research approach, we were able to do a thorough study of, a combination of qualitative and quantitative research to understand what are people actually looking for in a plan, and can they successfully complete the tasks. We white labeled the questions in Prototype to make sure we removed any kind of risk of a brand bias. If you say a name of a brand, it might trigger a thought for someone. And then an important thing that we broke from is it's actually tradition in proper user testing to not ask a user to imagine. You're asking about a state that isn't a reality. But in our case, we actually did want them to do that, because we said, okay, here is a page, and if you click on this button, what would you imagine being the next page? The reason we asked it in that way is we wanted to make sure that they were leaned into the experiment, and that whatever we showed on the next page was aligned to what they expected to see, so it wasn't a jarring experience. And then just closing this out here, in terms of what we learned from our actual audience, a couple things that weren't too surprising, but really critical, and then one big reveal. So people don't want to read anything. Not surprising on the surface, but if there was extremely low engagement amongst any kind of long form content. And it was broken into various pages as a result, deep focus on necessary content. And the next is we asked people, okay, well, what do you care about the most in terms of, a plan? And we put options like coverage and reputation, but cost is king, right? So that was really critical to understand. I mean, 80+% of people saying that. And then really the biggest finding that demonstrated why this whole lean research approach mattered so much to us, and actually designing with the audience, was we were able to remove our own accidental biases. The best practice in design and technology is, a need for speed. If you are shopping on anything e-commerce, or frankly, even in healthcare, you want people to get where they need to go in terms of page to page within a fraction of a second. So we took a lot of pride in making sure our recommendation engine would deliver fast results, so people don't have to wait. But 65+, they don't trust inherently AI, right? So we learned that when we slowed down the time after they input their data to get to the results, they actually felt much more confident that this solution was designed for them and that it was personalized to what they were looking for. They said, oh, I see that it's thinking. And had we not actually designed with our audience, we would have missed the mark. We wouldn't have even understood why it was that people, weren't engaging when it was extremely fast. So that really helped.
Wow, that's so. I'm going to just quickly summarize. If I'm taking notes here, the big aha moments. Obviously, a patient or a consumer-facing feedback and consumer-centric sort of modeling. But I think we all do that to some degree. It's sort of an N of 5. Over an N of 5 tends to get diminishing returns. So let's not go crazy with the investment and sort of market research. Number 2 is to not assume that some of the things that we as marketers or we as healthcare leaders assume, and that quick is always better. That's a fascinating finding, that persona believes that the slower response rate drives more
right.
genuinity. That's great. Really cool.
Yeah, absolutely. And we were very fortunate. I mean, it's early days on the results, but we're seeing a 300% increase in the completion of buy online process, which is translated to the same 3x increase in total sales of Medicare Advantage.
All right, let's move over to one of the more near and dear places in my life, and that's Western New York, where my wife's from and where I got married to Susie Hume. And Susie, how can now, with that sort of as a stage setter, how can health plans like yours convert competency from sort of traditional population health to some of this individual-based care and really get to know the individual healthcare consumer in a way that allows you to connect with them better?
Absolutely. Thanks, Eric. So, I mean, we at Excelis Blue Cross Blue Shield have been on a transformation journey over the last 5 years. Really.
Hey, Susie, I don't mean to interrupt, but I guess I do mean to interrupt. Can you just speak up a little bit? Your volume is a little bit down. We could hear
Okay.
you. I think if you could maybe, speak loudly like you're outdoors.
Okay, will do. I've never been told I'm quiet before, so I'm shocked right now. So yes, we've been on a transformation journey the last 5 years, really in regards to our digital experience, our member engagement, and a lot of the research that we've done over that time, it echoes a lot of what Susan and Steve have both hit on as well, is really needing to talk to our members, understand what they want and need, right? So when it comes to personalized or individualized care, really knowing what our members want. And as a health plan, in talking to our members, not probably shocking to some of us, they really want us to be brilliant at the basics, right? So there's many things maybe we want to tell our members as a health plan, and there's sometimes a disconnect maybe to what we want to say versus what they really want us to do. It's being great at things like, you know, claims, paying my bill, all of those transactional experiences. Those are a lot of times the moments that really matter to our members. And sometimes those can be, you know, even very heavily, you know, emotionally charged moments just in something like paying your bill. So it's incredibly important that even those experiences are personalized. So while we've been building those things, we've also been building the foundation around what we call next best action delivery. And the important thing here is really in establishing that trust and therefore getting the influence with our membership. We can really then focus on helping to serve up through what we know about them, what they've told us, what their actions also tell us. What's the next most important thing for you to do when you're already engaged with us, right? So in that moment where you're paying your bill, you're checking your claim, there might be 100 things we want you to do, but what's the most important thing for you to do next? And how do we serve that message up in the right channel at the right time? So Susan hit on digital's not always the right channel, right? I work in digital, but building the foundation for these things is also understanding what is the right channel to communicate that message, personalized for each individual member. And the important thing here in developing that is, you know, internally as an organization, that we're not cannibalizing that attention away from each other, right? If somebody in one area wants to make sure we're closing a gap in care and somebody in finance wants to make sure a member's paying their bill, truly prioritizing what is the next best thing for the member to do from a business perspective, but also from them where it truly can add value to that individual member. So that to me is one of the most transformational things that we're focused on, to really personalize and individualize that care for our members.
Yeah, that's fascinating. And also, I think, at least from my perspective, a blind spot thinking about the bill pay process as an opportunity to do all of that. I'd be curious, and this would be actually an opportunity to use chat, everyone, if your organization's taking advantage of the bill pay experience to reduce anxiety, gain trust, and do a lot of the things that Susie just mentioned, because that's an interesting bright spot right there. And I'd be curious to know if your organizations are thinking that way as well. All right, let's get on a plane and go down to sunny Miami and the corner office of Anna Eberhard. Anna, how about an example from where you guys sit about around shared savings and how to leverage maybe, you know, we all talk a lot about value-based contracts between organizations, but how do you use shared savings and shared cost savings with your members to engage them and get them more involved?
Yeah, I think building on what all the panel members have said, you know, you start with a consumer first, and where are the biggest pains? And when we looked at launching a program that we recently launched in July called RX Savings Solutions, we looked at really where the big pains were happening in terms of healthcare, and pharmacy cost, as we all know, has been a very big pain point for our members. Why? You know, the pharmacy benefit really represents the most repeated transaction when you think about it for our members. It's also one of the fastest rising cost categories, right? So that combined with the fact of how much is really, when you think about the healthcare dollar goes into pharmacy, you know, if you were to do a carve out, about 21 cents, the highest portion of that healthcare dollar goes into, you know, RX. So knowing all this in terms of from a pain point perspective with our consumers, we look to be able to solve for in a way that would be proactive, right? Some of the issues around engagement and where they fail is that we build a great widget, a great offering that we think is great, and then expect people to come in droves to come at it, right? And so one of the components around the program, and I think what's really made it successful, is that it proactively reaches out to our members. So basically the way it works, if you allow me, Eric, a minute to take for that, is it's a program that we launched first by just with marketing, letting people know the program was available to them. So a lot of the initial outreach was very omni-channel. We reached out to our member base from our texts, from our emails, from any way, a passenger pigeon, any way we could reach out to our members to let them know that this service offering was now available to them, and basically ask them to enroll. And just from that big launch effort, we got a lot of folks to join. But the key thing is once they launch, right? Once they launch, the behind the scenes that happens is here we have the claims information of what our members are spending on pharmacy. We have an understanding of what's covered within their, of course, benefit network associated with pharmacy, and can really proactively do outreach to them and say, listen, if you're spending this much money on this medication you're on, here's an alternative that would cost you this much of a savings, and proactively do the outreach to those consumers so they're not having to dig around. They can go in the member portal and can look at what a comparable drug would cost them, but we actually reach out to them. And so this proactive outreach is, I think, where we need to lean into in terms of engagements moving forward. That personalization of not just reaching out to you with, oh, we have these services available to you, but how does it benefit you? And we know you're spending $200. You could be spending $42. That's a powerful message, right? That gets acted on. That's how you drive engagement, when you've hit at the source of the pain. The way the program works is a variety of ways, right? No-brainers, you think about, substitution from a brand to a generic. Yeah, that's a no-brainer. But there's also around therapeutic alternatives. There's also around dosage optimization, or even the fulfillment and how you get your medications. All those can present savings to you. And so we do the heavy lifting of finding those opportunities for you, and we send it out to our members. And it's really been, that's why I love the name of your program, Bright Spots, right? Because it's really been a bright spot for us, at AvMed. We've been able to secure within, from July to end of August, I think it was 1,000 members that signed up, just off of the marketing before we started our proactive outreach to let you know, hey, you got $42 in savings. Just from that, we were able to do that. And when you think of what does that mean to a consumer, I can share with you just kind of a simple example. A consumer that was on some medications for cardiovascular disease was spending, and let me, if I can look at the actual number to get in front of me, was spending about $85 for a 30-day supply of the medication that we're doing. It was also costing the plan, right? Because this is a cost share. It was costing us $69 for that medication. We did the outreach to this member. The member said, yes, I'm interested in taking advantage of the savings. The great thing about the program is that we made it low friction. So the consumer has to do, the only thing they have to do is tell us, yes, I want to take advantage of the savings, reach out to my doctor. So then there's an outreach out to the doctor and said, the member has said that they would like to take advantage of the savings. This is the recommended exchange for that medication. The doctor has to approve it, goes to the pharmacy, we facilitate that, and the member is communicated to and said, your new script is available with your pharmacy. You now have available to this medication for your condition. And for this particular example, which is a real example, we went from having a member that's spending $85 on that medication for a 30-day supply to switching them to a 90-day supply of an alternative and then paying $0. And for our cost share, going from $69 for that 30-day supply to $6.61. So
Win-win.
It's a win-win, right? I mean, we are doing what we should be and what AvMed is all about, which is advocating for our members. But in doing so, we are also helping ourselves from a perspective of cost. So I think those kind of programs that allow us to help both, and I think the people on this call can relate, really also help to sell through within the organization, the prioritizing of these kind of programs to get worked on sooner rather than later, because they're low-hanging fruit, right? There's where everyone wins.
Anna, just for our own perspective, the single example you gave, was that a Medicare member, and is this program for Medicare specifically, or was it your commercial population? Or?
Right. So this was a person who was 64, not yet signed up for our Medicare offering. This program is available to all fully insured members, commercial. That means group and IFP as well as Medicare.
Okay, great. And those who didn't see in the chat, I know I failed to introduce everyone by their name and title and affiliation. I put that into the chat. I apologize. I don't think.
He feels like he knows us so well already.
Yeah, I do 100 episodes and I've never done not done that. So I apologize to everyone, and especially our panelists. So speaking of Medicare, let's shift a little bit to Medicare. Maybe I don't want to call it Medicare specifically, but let's call it the technologically disconnected patient population, and bring Susan back in. Susan is up here in my hood in Boston with Mass General and a small little hospital called Massachusetts General Hospital. Can you share your thoughts about how you approach connecting with these more technologically disconnected patients and how you're advancing communication with them?
Yes. So during COVID, at the outset of COVID, in March of 2020, we flipped overnight from doing almost everything face-to-face to doing almost everything virtual. We have a fairly large geriatric medicine practice at Mass General, and we were all very concerned about the patients in that practice, and basically our older patients and people with complex conditions across all of primary care. And so we decided to test a model that we call virtual town halls. And so in early April of 2020, we started offering these town halls initially almost every other week, because there was so much changing information about COVID, about everything. And so we invited all of the patients in the geriatric practice. And then we quickly moved to start inviting patients from over 65 and people in our case management programs who have more complicated chronic conditions to participate in these town halls. We had hundreds of people participating. The concern about the digital divide basically did not show up. I mean, we had anywhere from 75 to 250 people in each town hall.
Susan, were you using Zoom or?
We were using Zoom.
Okay.
And we recorded these, and then they were recorded in a way so that there was no personal health information shared. You couldn't see the participants. You could only see the speakers. And then we put all of them on the MGH YouTube site, so they got even more visibility. But we covered content like the ever-changing information about what was happening with COVID, what was happening with masking, what was happening with vaccines. This population was very concerned about grandkids. They were very concerned about how to get virtual care. Many of them had lost all of their services because home agencies could not come in. They lost their PT. We were actually doing exercise programs online, cooking classes online. We tried to do things that would cheer people up. And so one involved Yo-Yo Ma performing. And we also invited the clinical staff of these practices to participate. And I think one of the things we learned quickly is that these were incredibly inspirational for our patients, their families. Many of the older patients would have a caregiver or a family member somewhere else in the country on the Zoom with them participating. We also did sessions on almost every single one about how incredibly important it was to have a healthcare proxy. Probably you may need two, because we knew people were coming into the hospital and they couldn't have any family with them. And we also talked a lot about how to think about what matters most to you when you can't speak for yourself. So we literally have done these for thousands of our patients. We wrote a guide, and I'm happy to share that with anyone that's interested in how to do this. It was very low cost. We're continuing them. We now do them on a monthly basis. And we're now back up to talking now about the booster shots, masking. COVID has changed everything in terms of medical information. And the people that did the presentations We're a combination of our geriatricians, our infectious disease experts, and our primary care clinicians. So I moderate them, and I have to say, I look forward to every single one because they're sort of like a family reunion. And one of our practices even created a YouTube that was all the people in the practice who were no longer able to see anybody in person for a while, talking about how much they loved their patients and how much they missed them, which was really fun. So I think this is something that we're continuing. We're now using this vehicle to communicate about all sorts of other things, like for our older patients, why you may or may not need to continue doing screening when you're over a certain age, and where is that appropriate and where isn't it? As well as continuing the focus on why it's so important to have a healthcare proxy.
Well, really good example. And why? Well, we'll put up a poll in a little bit, folks, if you want a copy of what Susan just offered up, because I'm sure a bunch of you are trying to figure out how to get that. So we'll do that for you. Let's, Steve, let me bring you in, since your first example was Medicare. How are you guys? Is there another example you could provide where you're thinking about the sort of the technologically disconnected and how to connect the dots there in a pragmatic way?
Sure. Yeah. I think all of us, we've talked about patients with chronic conditions, and then, that tends to mean 55 plus, right? And Anna brought up an example. I think it was in something related to cardiology. And similarly, what we saw in a past life was there was an experience where we were working with an organization that was trying to better their relationship with heart failure patients. And just very, very quick context, I think we really need to recognize how far we've come in terms of technological adoption in the past 10 years. I think that's what's caused the stigma. 12 years ago, I transitioned into health innovation, and the big story is that 51% of the US population had smartphones, and that number was only expected to grow. Completely irrelevant to where we are today. But at the time, it was a stretch to suggest that 65 plus would use smartphones because they were not the early adopters. Now they have them. And Susan very clearly just proved that. Granted, it's more web-based, but the thought of someone using Zoom could sound daunting, but they're there and they're extremely engaged. So in this heart failure example, we wanted to help inform patients and their care team, because to Susan's point, the caregiver actually is a blind spot. They're an interesting opportunity of engagement. So we looked at all types of wearable technologies because we really wanted to help people track data. And honestly, it felt like a scene from Tin Cup, if anyone knows the reference, where Kevin Costner is wearing a bunch of gadgets and he can't even swing. It was a little bit much. So we learned two quick significant things. Number one is 65 plus will use technology, but you have to make it very familiar to them. So a patient will use a pill box, they'll use a weight scale. And in our case, they were Bluetooth connected and can passively track data through the cloud and send that to the care team. If you try to put a wearable in front of someone and it has a high learning curve or asks them to very actively, thank you, exactly. I see your reaction, Susan, like good luck. And the same goes for an app, right? If you want them to use an app, they will. They have a smartphone, but it has to, back to Anna's point, it has to be frictionless. It has to be very simple. And the last quick finding I think that was important is the significance of the caregiver. So caregivers tend to be younger. They might be a spouse, a sibling, a child, and they're really motivated to help their loved one, stay on the right path. So last Kevin Costner reference, I promise, if you build it, they will come. It doesn't actually work in this case. We wanted to engage the caregiver, but we recognized that, congratulations, you have an awesome app, but how are you actually going to get this into people's hands? So we partnered with, wonderful providers, networks, hospital networks, and advocacy. And the significance there is it needed to be a very, very simple message. We had a very powerful app. It was a Swiss Army knife features, but through the research, we found the one thing that people cared about the most was, how can I keep my loved ones safe? So we told the providers in the advocacy network, that is what this can do. they shared that out. It was easy to retain the information, and it had a very successful starting pilot.
Lovely. You know, you wake up in the morning, you know, you're going to get 2 sports movie references in the show. So that's really exciting.
I think I did it for you, Eric.
Yeah, I appreciate it. So I mentioned at the top of the show, I was going to fill you in on why I brought in Appnovation into sort of the Bright Spots family. And it's sort of here's the deal. And it's not about sports movies, but you might have gathered from hearing from Steve already, they have some extensive experience throughout healthcare and life sciences and those industries, but and they do it all, right? Defining, executing, and then validating the digital engagement programs for patient and caregiver audiences. But that is really not specifically what drew me to them. They have a team. So Steve's one of over 400 in offices all over the world, actually, and they work with clients both in healthcare, but more importantly, for I think all of us outside of healthcare. So we have a ton, right, to learn about how to leverage digital to build engaging relationships with our healthcare consumers. And other industries in certain areas have certainly evolved. Their bright spots are many, and how they've been able to engage their consumers. So I think just an organization that has this kind of global breadth and experience in enabling clients and how to rethink their approach to consumers more effectively and bring some of both healthcare and non-healthcare examples to all of us, as far as bright spot examples, will be particularly valuable for all of us to hear and to learn and bring back to our organizations and consider applying. Retail, hospitality are both industries that we should be looking at. Appnovation works with all those, a lot of those clients to do some of the cool things around consumer engagement tied to digital. So they have an interesting, what I'll call, it's not even a white paper. It's more like a blog post that we have access to that if you want to read, it's a 2-page read on how to balance industry inspiration with healthcare realities that can give you a little bit of a sense of some of their cross-industry experience and how it gets applied to healthcare. And you may want to review that. So if you want a copy of that, I will personally email it to you, so you don't have to go on to a website and fill out a form or anything like that. I'll just send it to you. I'm going to put up a poll, or Sherry's going to put up a poll, and if you click yes, I'll send it to you. And so you can have it in your inbox by the end of the day today. But again, really cool organization, and I want to thank them for supporting this episode. We can't do these types of programs without companies like Appnovation. And again, appnovation.com, you can get a whole lot more information than I was just able to provide you. Steve, I'm going to keep you on the hot seat briefly here. And if you, since I set you up sort of for technology and communication, can you provide an example of how we're providing or how you're providing technology and communication on behalf of your clients to build a trusting relationship, maybe with, let's say, an underserved population like Medicaid?
Yeah, no, it's an interesting, way of framing it for sure. I think, so we actually have an example that is ongoing right now, and one is with the provider side, and then of course on the Medicaid side, it's with a payer. They're both West Coast based, and they have a very similar challenge. So the upfront thought was very technology based, and I just want to quickly talk about an approach to kind of avoid that. And actually, it's very similar to what Susie was talking about being brilliant at the basics. And our mutual friend, actually, Marie, is the one who kind of adopted that strategy for us with some of our clients. So in this case, with the payer and the provider, both organizations have a great deal of knowledge, and we're helping them untap that to turn that into execution. And the problem is that historically they've both looked to, and I'm sure this is the buzzword right now, they've looked to transformation. And the challenge with that is it often feels too big, and it's hard to kind of gain any momentum. That's why I love that you said the brilliant at the basics bit. And then on the other hand, there's, I'm sure you've seen in your organization sometimes a knee-jerk reaction to move to one-off tactics like a chatbot that, helps the hospital network site, provide the viewer with a way to navigate the site. It's not necessarily a bad idea, but how is that tying into the larger patient engagement strategy? And has that been validated at all with you know, the patient population? So what we've channeled was this idea of transform is fine, but do it incrementally. And what we do when we think about technology is we try to think about, okay, well, both organizations found that when they thought about their patient engagement plan and strategy, we could set up a roadmap so that we can find quick wins right now while establishing that ambitious transformation idea on a parallel path. So again, it's early days, but it's been really exciting to see in this road mapping. We'll do the standards, the tried and true methods of, you know, personas and journey development, everything that we're all familiar with. But in this case, we were really able to find, you know, this beautiful bright spots, as the show is themed, to find what's working well in the market. And we did that through some extensive social listening to see not only what are people saying to the early question about, you know, Medicaid specifically, but you know, what are they saying about the brand? And then we found actually a competitor that gave a great example of how they're really doing a great job of building trust in the network. So identifying that bright spot and then really shifting that into how that informs our roadmap to emphasize what kind of design and technology ultimately would need to be used to realize the potential.
Interesting. Listening to the market, understanding that there was a brand out there that did connect with that population, understanding what they were doing, that bright spot, and seeing if you could clone it for your client. By the way, folks, I think bright spots and I have been mentioned 2 or 3 times by our panel. I do not pay them to give us mentions, but I still may send them something extra for mentioning. No, thank you. All right, let's talk about digital and human resources. Like, not everything is scale, not everything is done through your digital platforms. So Susan, how are you effectively combining digital platforms and human resources to build a relationship with your members, your patients?
Well, I'm going to talk about something now, and now I'm channeling our senior leader of all of our virtual telehealth, Dr. Li Chuang, who's a neurologist who has led a lot of the national work around telehealth with stroke care. And again, I mentioned earlier that we pivoted immediately to almost everything being virtual, but one of the things that we realized very quickly is that many of the patients that were most hard hit by COVID, served by our community health centers, did not have smartphones, did not have computers, and all of their virtual care was basically being provided by phone, which was challenging for them and for our clinicians. So in the wake of everything we learned about providing better digital and virtual care to our underserved populations, we are now implementing a digital access coordinator program. And so we are hiring digital access coordinators, bilingual people that speak our 5 most common languages, or our 6 most common languages are Spanish, Portuguese, Haitian Creole, Russian, Arabic, and Mandarin. And so we're hiring people that speak those languages. They are going to be working directly with our patients to help them understand how to enroll in our patient portal, which is my chart, but we call it Patient Gateway. And they're also going to be, we're testing 2 models. One is they will be embedded in our practices so that when one of our clinicians realizes this person needs help, they can do a warm handoff with the digital access coordinator. We're also having some of them in our central offices that can be called and connected via a warm handoff on the phone, and then they can either get together with the person or interact with them by phone to help them get access and understand how to use all the things that we're offering virtually and how to get into our and enroll and use our platform, because that's really our most common way of communicating broadly to our patients about pretty much everything, especially now. So we're excited about this program. It's just getting started, and we'll have more information about that in the future if people are interested.
Great. Susie, what about you guys? I mean, how are you combining tech and human resources?
Sure. Yeah, I think we we talked a little bit before about kind of the importance of building that trust with our members. And I think one of the things that concerns me right now is how just busy the tech landscape is for our consumers, right? There's, I think I read recently, over 400,000 apps now in the App Store focused on healthcare, but like 95% of them have less than 10,000 downloads, right? So we when it comes to technology, and there needs to be kind of what's the value in it to me, and how do you connect and integrate all of the things that you're offering into something that's simple and easy to use, right? Instead of just continuing to flood, for our members, in order to do business with us, you have to download 50 apps. That's of no value. So we're focused right now on building what we call digital triage, which does a number of things. It can be simply just that tech integration of connecting all of these point of service solutions, but we're layering into that as well this single integrated point of chat. Whether you have a question about, more of a customer service related question or a clinical question, you have a single place to go, via web or mobile app chat, that you can get answers to whatever that may be. So, a sample, use case here might be, I have a headache, and maybe as a member who has a headache, I need help with care coordination of where to go. Do I go to urgent care? Do I go to telemedicine? Do I just take Tylenol? Maybe though, my question is, what's it going to cost me if I do that, right? And so instead of sending a member to many different places to figure out all of the answers to the questions that's going to create for me, it's this single point that I can not only get the answer about my eligibility and benefits question or the care coordination and triage from a live person. Maybe there's some chatbot functionality that helps me if my questions is simple about what was my most recent claim status. But also if ultimately the best thing is for me to see somebody via telemedicine, pull that visit directly into that chat window for me. Don't make me now leave the app, go open a different app, right? Everything coordinated and integrated into a single point for our members. And I believe that really will help not only build trust, but you'll also continue to expand that relationship with our members.
That's great. It just occurred to me, I meant to ask everyone this earlier, because as I'm here in Boston, in 2019, I was at the health conference in Vegas, and it was fantastic, and got to see a lot of you guys there. And it's here in Boston in October this year. Sherry, do you mind just put up a poll? I'd just be curious who's planning on attending that conference, because I'm trying to decide if I should be going. But if a lot of you guys are going, I'm going to certainly make the time to attend as well. Let's shift over to Anna. I'd love to talk about predictive analytics, right? We haven't really talked about how to predict what's going to happen to members, what's likely to happen to members, and use that to promote action. And I'm wondering, what you guys are doing at AvMed to leverage data to drive behavioral action.
Yeah, we've been using data for a while. I think what we've done different is try to introduce data from outside of the four walls, right, to augment what we already have available, because we do have a lot available on our members. But there is about understanding what's happening outside the four walls of our company to help get, instead of relying on the history, looking at the future of what could happen. A particular example doesn't rely so much on necessarily on outside those four walls, but that's something we're doing more and more in terms of incorporating predictive analytics to be able to avoid, a cost for our members, to be able to get them at the right path, right? In terms of cost, which is so important to our members, one of the things that we're looking to leverage analytics around is we have had transparency tools. Probably all players have those available. We at AvMed also have transparency tools that are connected to incentives as well, so you can leverage some rewards of it. What we're looking to do is, instead of just promoting that they exist, it's going to be outreach, right? We have an understanding of what certain cues can show us that you're going to be needing what's next, the next action. I think, Susie, you mentioned something earlier around next action, right? So if we've seen a person that has had a claim or had an encounter as a result and went to a doctor and maybe went and got x-rays, and maybe next has PT, et cetera, we can predict what might be the next step that they may need in their care journey and offer up proactively to them. By the way, we do have a transparency tool and we have rewards or incentive around that transparency tools. You might want to shop for the best place to get X, Y, and Z procedure. So again, stepping away from, like previously when I was talking about that passive, hey, come to me, whatever, to very personalizing the communication and outreach based on what we know about you, and do that heavy lifting on our end, right? Just serving up for you for what we know about you. This is probably something that's going to help you. And in particular, in this case, it's around a cost savings.
Thank you. I'm going to close things up a bit with answering the same question we started with: why patient engagement typically doesn't work in healthcare. Steve, I don't know if you could come back on and maybe give your perspective on it. It's a little bit different from what maybe Susan said at the beginning.
Right. Yeah. Well, there's bright spots in healthcare, and then there's blind spots. And in this case, when you think about innovation, there's a blind spot in change management. And I know everyone on this call, and probably all the listeners too, we've all experienced this idea where there's a great idea, and regardless of how well intended and thought out that idea is, you can have a hard time getting it off the ground. Maybe it's due to stakeholder alignment challenges, planning for patient engagement with the digital platform, or the maintenance. But that's kind of the unspoken thing that isn't often planned for, this idea of change management. So just very quickly, maybe, what's the bright spot associated with it is we worked with a large global organization to break through this, as Eric labels, corporate inertia. And it's all about making sure that the organization was ready and willing to embrace innovation change. So the three quick things are, you have to establish a WIFM. So what's in it for me? Why should people you work with want to buy into your strategy? How does it align to their work? How does it help them as individuals, right? I think to some degree, we're all some form of selfish and concerned with our own agendas. And then, in a lot of cases where we're all mature companies, there's different departments. Can you identify some change champions in the organization? Who are the trusted allies? So that it's not you against the company, who in other departments will help champion that message. And then the last thing, to make it easy for those type of champions to help you. Innovation, and when we talk about patient engagement, transformation, and these kinds of plans, they can be really robust, but how can you make it really, really clear? What's your elevator pitch? So that people can gravitate towards the main message and then help champion that internally.
Great. I love that, because Susan provided sort of the forward-facing sort of consumer adoption perspective of why engagement doesn't work. But there's also, hey, you may have gotten that right, but there's corporate inertia and how to navigate your way through that and recognize that. And I know hospitals know that all too well when you implement any kind of new operations technology to get that built into the workflow. And sometimes that's why they fail. It's not necessarily the technology, but it's the planning that goes behind it. So I appreciate you bringing that up. I know we have a few minutes still left. I want to throw a couple of questions from the audience out to our group. There's a question, and I'll lob it up to anyone who wants to grab it or more. Is anyone on the panel asking members if they do not want to use technology, but only want to use human answers, AKA not chat boxes? Someone want to grab that?
I'd be happy to, but does anyone else want to lead off, or? Okay, sure. Yeah, it's a great point. Could have been mentioned. So there needs to be a fair balance, and sometimes you'll end up finding out a great solution that is surprisingly feasible. So in testing one time, we were asking exactly about a chat bot, and the strong preference was for a nurse to actually provide the information. And they went into great detail about why and the credibility. And we ended up piloting something there where, yes, there's an upfront cost associated with having a nurses network do phone calls, but it ended up being more feasible and realistic than the chatbot. So even if you don't go into great detail, it does seem like fair balance to at least ask digital and non-digital, and digital doesn't have to be the solution, to the earlier points. What's the pain point and what are you looking to address?
Eric, if I could piggyback on that, I think what's been important for us at Appman has been to really build the omni-channel experience, because what we find is that a consumer isn't about a chatbot or a human interaction. Sometimes they want a chatbot, sometimes they want a human interaction. So omni-channel has been built. Well, the progression has been point solutions, then you get to omni-channel, and omni-channel, for it to function properly, is to have all channels available, and then ask for preference and learn from what the preferences are. Because I think where the pitfall can be is that we assume that everybody wants, or that person even that selected that I want to talk to a human will always want to talk to a human. And what our experience has been is that that same person, depending on what their need is, depending on that moment in time, wants to be able to talk to a human or wants to self-serve and get it done through technology in a quicker, faster way. So for us, it's really been about going from point solutions, connecting them. Susie shared a little bit of kind of her in her chat example. That's a similar approach to what we're trying to do. How do we bring all these things together so that people have a way, and it's learning from other categories, right? So healthcare has been a little laggard as it relates to that, but there's plenty of good examples out there of how to really surface up all the different ways we can connect, and just leave it up to the consumer to decide at that point in time which is the best way for them.
It's great. I'm in this weird, I know we have we have like 3 minutes left. There's a couple of questions. I'll ask this has to be a short answer. And how are we dealing with other languages like Spanish? How are you guys thinking through that? I know that's not as easy as said than done. Does anyone have an answer for that?
I'm not dealing with, our system has a United Against Racism initiative that is in the process. We're centralizing all our interpreter services so that we make sure that we have broader reach and that we have all the languages that we need. And we also are doing the same thing with translating all of our most common patient education materials, decision aids, and all sorts of things. But that's obviously not all done or delivered digitally, but that is a huge multi-million-dollar initiative.
I think maybe the same can be said for accessibility standards too. The critical importance of making sure that any digital initiative adheres to the right level of accessibility.
Right.
And worse than that, to be honest, you can kind of fall flat if you're not adhering to the standard levels, get in a little bit of trouble for that, or just it really hurts your reputation because it doesn't demonstrate the level of leadership.
Yeah. And just to add one other thing to that, one of the other things that we're learning from feedback from our patients is that not only is the language important, but also the delivery mechanism, so that we address people with visual impairment, hearing impairments, and that sort of thing. That is actually pretty common.
Yeah.
For us in Miami, everything we do has to be multilingual, because that's just how South Florida is.
Yeah. I really appreciate it. Folks, before you all take off, and Sherry just through chat reminded me, so I have this is a really cool episode next week. I have the privilege of having a gentleman by the name of Cal Fussman come on the show. And if you haven't heard that name, I encourage you to Google him. He is a world-renowned journalist and interviewer and storyteller. He's interviewed all kinds of celebrities, prime ministers, presidents. The fact that he's willing to come on our show is super special. And maybe even a little intimidating for the guy who's going to be interviewing one of the greatest interviewers in media. But he has some really, he's done a lot of research around storytelling and healthcare recently, and he's going to come on and share some of that with us and how we could adopt some of the best principles that go into some of the most successful books and articles that we've ever consumed, and how to apply that to healthcare. So I think it'll be really interesting and cool, not just for me, who looks up to this person as a host and moderator, but also for all of you in the industry. So I encourage you to go on to Shared Purpose Connect, register for that for free. And we'll be recording that live next week, same time on Thursday at 12 o'clock. All right. Thank you to the four of you. This has been great. I'm going to ask you to stick around in a moment. I'm going to say goodbye to everyone else. Hope to see you next week when we interview Cal Fussman on the power of storytelling in healthcare. Really appreciate all your participation, and please take that survey so we can continue to earn back your 60 minutes of time each week with valuable content that keeps you coming back and contributes to the betterment of healthcare and all the consumers that receive healthcare, which is all of us. So thank you very much, everyone.
Eric, can I add a quick comment about storytelling?
Yeah, go ahead.
If people are there, we have found, and I think this has actually been studied in healthcare. If you want to, speaking to what Steve said about change management, if you want to change people's behaviors, tell them a good story. This has been studied where people have looked at, does data change, story and data, and story always wins. I can tell people a story about a negative patient experience, and I've showed them pounds of data documenting this happens a lot, and they're like, oh, okay. And you tell them one story, they change the next day.
There's the plug. I should have you plug the whole episode next week.
Love that.
All right, thanks again, everyone. I'm going to stop the recording. See you guys all next week.